Nephritic Syndrome. Nephritic syndrome, portrayed by the nerd cricket, is characterized by inflammation of the glomeruli, depicted by the nerd cricket on fire. This syndrome is characterized by hematuria, shown by the red urinal with the presence of RBC casts, illustrated by the red blood cell with a leg in a cast. RBC casts are important because they indicate intrarenal pathology and help differentiate nephritic syndrome from post-renal disease processes that can cause hematuria. Other common findings in nephritic syndrome include azotemia, a medical condition defined by abnormal amounts of nitrogen products in the blood. This is illustrated by the pile of nitrous tanks with gems, foreign nitrogen. Oliguria, or low urine output, is also common, shown by the old gopher in front of the urinal, as well as hypertension, the hiker taking the nerdy cricket's blood pressure. Proteinuria is also frequent, although not as severe as those encountered with nephrotic syndrome. Therefore, proteinuria less than 3.5 grams per day is a diagnostic criteria for nephritic syndrome. This is illustrated by the urinal with protein structures depicting proteinuria beneath a 3 tree with a 0.5 tag.
This nerdy cricket is angry to see his school's tree getting abused by the red blood cell. In fact, the nerdy cricket gets so worked up that his fellow hiker must remind him to keep his blood pressure from getting too high. The 3 tree has a 0.5 tag to indicate that the tree is being treated half as well as it should be. This red blood cell in a cast may deserve some sympathy for his broken leg, but that does not mean it can just set up a red urinal here and charge people to use it, especially when it is taking advantage of an old gopher in dire need of a urinal. The red blood cell is mistaken if he thinks the nerdy cricket is going to let him charge the senior citizen all of his nitrogen tanks just to go to the bathroom. It is times like these that the nerdy cricket loses his temper.